Dr. Chen is very well known for his work in traditional Chinese medicine and herbology as both a TCM practitioner and as a pharmacist. So another example of integration. I asked him last night, where did he begin? And he started with the medicine practice and then went to pharmacy school. So he brings a wealth of information to us. You see in his bio all the work that he's done, and is currently founded the Evergreen Herb Company down in Southern California. So we're very fortunate to have him, and I hope to keep him as part of our partnership as we go forward. Dr. Chen. It's this, and whatever is here is what's on the screen.
Thank you. Okay, thank you, Charlene. Well, first of all, I want to thank Dr. Amy Mateki and Alex Fang for inviting me to the conference. I'm having a great time, meeting new friends, catching up with old friends, and also learning quite a bit from our speakers this morning. So again, thank you for having me. My topic today for today's presentation is safety of herb-drug interactions. And this is a topic that I have actually been teaching for quite some time, probably going back 30 years or so. So if you would let me tell you a little story before I begin. So what happened was I went to acupuncture school in the 80s and then pharmacy school in the 90s. And when I first started practicing, it was quite interesting because I remember practicing in retail pharmacy. Back then it was Payless and Thrifty Pharmacy. The patient that come in to pick up the drugs or patient that come to the pharmacy actually asked me about herb questions. They would ask me about St. John's wort, about valerian root and whether it's the same or different with Valium, and all other supplement questions. And in the beginning, I wasn't sure why. Why were they asking me about all these supplement questions? And as it turned out, what happened was my coworkers, the other pharmacists and technicians, knew that I was also an acupuncturist. So whenever there were questions about all these other supplements, they would automatically direct the patient's questions to me. Okay, and the reason, of course, is because when I went through pharmacy school, we basically got 1 hour of education on dietary supplement, and that was it. Okay, so as I work as a pharmacist, I find myself answering more questions about herbs than I do about drugs. And then every once in a while, I will have a get-together with my acupuncture friends, TCM practitioners. And what I found out was they have a big dilemma. And the dilemma is 30 years ago, Chinese medicine was quite literally the alternative medicine. So most of the patients have gone to medical doctors, got their diagnosis, take the drugs. And if they were not very happy with it, they would seek out second opinion. And a lot of time it could be the acupuncturist or the herbalist. And inevitably, then what happened is, as the TCM practitioners see the patient, evaluate the signs and symptoms, determine a diagnosis, and then the final step, of course, is to give the patient the herbal prescription. The question then came, well, are these herbs compatible with the drugs? And none of my colleagues know what to do. They don't know how to answer this question. So they asked me to give them a little talk about herb-drug interaction. So 30 years ago, that's how this class was originally started. And back then, what happened was I did a lot of research, but at the time, there was really very little information. So there was a lot of theories, there was a lot of hypothetical situations, but really no case studies or there's no organized information. So then, as time goes on, I find myself doing more research and more teaching. And what I found myself doing was I ended up teaching Western pharmacology at many of the TCM schools. And I find myself teaching herbology at some of the pharmacy schools and also medical schools. And that was quite interesting. Okay, and I remember when I teach at pharmacy school or some of the medical school, I had to purposely restrain myself not to use terms like yin and yang and qi, because whenever I do that, I would lose the audience. They would roll their eyes and they wouldn't pay attention to any more things I say. And then 30 years later, here I am listening to Dr. Freeney this morning talking about using acupuncture to treat qi and blood stagnation. So that was quite an OMG moment for me. All right, so here we are, learning and talking about herb-drug interactions. And I think this is important because obviously the most important thing we want to do is to help the patient, and we don't want them to have any adverse reactions or side effects as much as possible. So while herb-drug interaction is still a relatively new science, there is actually quite a bit of material that we can go through. And that's what I'll do today, go through some of the fundamentals of herb-drug interaction, as well as giving you some specific examples, or perhaps times when drug and herb should not be used together, or general precautions that we can use to recognize and also prevent the herb-drug interactions, okay? This is a general statistics that about 80% of the world population uses some type of complementary and alternative medicine. Okay, so patients are out there, trying to find out what is best for their own personal care. Obviously, Western medicine plays a big role, but complementary and alternative medicine also play a big role. So a lot of people are taking herbs, taking supplements, and so on. Unfortunately, even though both sides, Western medicine and complementary medicine, are coming together, I think there is still a big gap, probably the size of Grand Canyon, that we had to fill, okay, before we can really work together side by side to help the patients. Okay, so I think today is one of the first steps. And this is another article that I found, which is quite suitable for today's theme, and that is the understanding of the relevance of herb-drug interaction. And this is what they call a prerequisite for integrated medicine. So that's what we are trying to do. So as we prescribe herb, as we prescribe drugs, we need to find out how to use both of them so we get the most effect and minimal side effect, if at all possible. Okay. Overall, the concept of herb-drug interaction is really based on these two main concepts. One is pharmacokinetic interaction, and the other one is pharmacodynamic interactions. So anyone who has had pharmacology should be familiar with these two principles. So pharmacokinetic is obviously how the medicine, or molecules, go into and out of our body as they travel through with absorption, then metabolism, distribution, and finally elimination. So within this natural pathway, if any interaction were to occur to affect the absorption, to speed up or slow down the metabolism or elimination, then this will be considered a pharmacokinetic interaction. So within the drug world, this is generally fairly well documented. But within the drug and herb world, you have some information, but not a lot. Okay. Same with pharmacodynamic. So this is basically the mechanism of action for the drugs and also for the herbs. How do they work? Do they work on the cardiovascular system or respiratory system? Are they agonists? Are they antagonists? Do they work the same way, or do they cancel out the effect of each other's? So once again, drugs is well established. Herb and herb is also well established. So within the traditional Chinese medicine, they are examples of herb that can be added together for synergy. So this is called a pair herb, or yao dui. So we purposely put the herbs together because the idea is it's 1 + 1 = 3 or 4. You get much more bang for the buck. Okay, and they are also examples of antagonism. So antagonism can be used to the benefit if it's a case of using one herb to cancel out the side effect of another herb. So we do that quite a bit as well. So as the two sides come together, we also want to try to maximize this as well, where we can perhaps use herb as a complement to alleviate the side effect of drugs, okay, but not to use herbs that cancel out the therapeutic effect of the drugs. Okay, so if you have a basic understanding of pharmacokinetic and also pharmacodynamic, and then if you go one step further, where if you are a Western medicine practitioner, start to learn a little bit more about the herbs, then this concept of herb-drug interaction won't be so foreign. And similarly, if you are a TCM practitioner, obviously you will learn about herbs, And in TCM, about 1/3 of our curriculum, 1/3 of our education is actually in Western medicine. So TCM practitioners do have one course in Western pharmacology and then internal medicine as well. As TCM practitioners learn more in depth about the drugs, this concept of drug interaction is also not that difficult. Okay, so basically you just need to break the initial barrier, start learning one herb at a time, one drug at a time, and then before you know it, you'll know some of the most important interactions to recognize and also to avoid. All right, so here are some specific examples. The first one is going to be with absorption. What happened with absorption is because most of the patients take their drugs by mouth, take their medicine by mouth, whether it's drug or herb. So this is an area where most of the interaction will likely occur, but then fortunately, most of the interactions are going to be relatively minor. Okay, so theoretically they will interact, but clinically you will probably not see too much significance. How absorption interact is basically through these four main pathways. One is binding in the GI tract, one is change of the stomach pH, one is change of intestinal motility, and last is change in the enzymes or normal floras. So basically, if the normal digestive system is affected in some way, then the patient may not be able to absorb the drug or the herb in a same predictable pattern. And here are some examples. The first one is with binding in the GI tract. So these are 4 drugs: cholestyramine, cholestyramine, estemabide, and also orlistat. These are drugs primarily prescribed for patients who have high cholesterol, obesity. And the idea or the mechanism of action is that these drugs will bind to the food, decrease the absorption of the food, the fat, the grease, and stuff, and therefore to reduce the cholesterol and reduce the obesity. And I remember as a pharmacist, we are required to consult with the patient on what drug they take. I would joke around with some of the patients that I know a little bit better, and what I would tell them is, do you realize what you're actually doing? You're eating these, spending money on these foods, and you're spending money on these drugs, and in essence, they bind to each other's, and all you end up with is expensive feces, and you're literally flushing money down the toilet. And I say that because a lot of patients, unfortunately, have the mentality or the attitude that they just want to take a pill that magically solves their problem. They don't want to change their diet. They don't want to change their exercise habits. They don't want to change their lifestyle. They want to do everything that they have been doing and have a pill solve all their problems. So I joke around this with the patient, hoping that they will see what they are doing and perhaps take a step toward changing their diet and their lifestyle. And here is an example of orlistat, basically binding to other drugs and affecting the absorption. So orlistat interferes with the absorption of many drugs, including warfarin, amiodarone, cyclosporin, thyroxines, and so on, and also as well as fat-soluble vitamins. So as a pharmacist, what I would tell the patient is, if the patient is taking any of those 4 drugs, I tell them to take it at least 2 hours apart from any of their other medications, but take the drugs right after meals, because the idea is these drugs are supposed to bind to the fatty component of the food, but you don't want them to bind to the drugs. And then at the same time, obviously, the patient is also taking herbal medicine. You want them to take these binding drugs, once again, at least 2 hours away from any other things that you want them to have normal absorption. Okay? And this concept of binding is also true in Chinese herbal medicine. The history of China is that it has always been a country with too many people and not enough food to feed all the people. So what happened is we grew up with the idea that any food that's fatty or greasy is good. It tastes good, it's good for you, because it's a rare treat to be able to eat meat, even when I was growing up. So Chinese food, Chinese restaurants tend to be more greasy in nature. So what happened as we eat the greasy food, of course, is you feel very tired and heavy after meals. So in the process, we also drink a lot of tea, whether that's green tea, black tea, or oolong tea. And what happened is tea also has a very strong binding effect. So all the fat that's in the mouth, in the tongue, in the throat, and so in the digestive system by drinking tea after a heavy, oily, greasy meal, it helps to bind it, scrape it, and flush it out of the digestive tract. So it makes you feel more refreshed. But what we also realize is tea has side effect. So if the patient historically is taking herbal medicine, we tell them to take it with water, and we tell them not to take it with tea, because tea would also bind to the herbal medicine and therefore decrease the absorption of the herbal medicine. Okay, so similarly, if you have a patient that take prescription drugs, you should also tell them to not take the prescription drug with tea as well, because that would also have a chance of binding to the drug and decreasing the absorption of the drugs. Okay, and in this case, we are referring basically to the Camellia sinensis tea, which is green tea, oolong tea, black tea, and also pu'er tea. If you have other tea, if it's chamomile, if it's ginger, those are perfectly fine. Those tea do not have binding effect. It's specifically these 4 types. Okay, and here's an example of tea binding to the drug Naldolol to reduce the Cmax, which is the maximum concentration, and AUC, which is the area under the curve. So this is an example of the tea binding to the drug and reducing the absorption of the drugs. Okay, so overall, like I mentioned, absorption interaction is something that's quite common, but generally speaking, not very significant. But nonetheless, if the patient is going to go through the trouble of seeing a doctor, getting the medicine, we want it to be absorbed in the normal fashion as much as possible. Okay, so don't take it at the same time with tea, and don't take it at the same time with a binding type of cholesterol or obesity drugs. Okay, and then as the medicine is absorbed from the digestive system into the blood, they are then distributed to many different parts of the body, or specifically the disease area, to carry out their therapeutic effect. Okay, fortunately, there are very few examples of distribution interaction. And the reason is because for distribution interaction to be a clinical concern, you need 2 factors to occur together. One is the drug needs to have a very narrow safety index. So maybe drugs like Coumadin, it's a very significant, serious drug that has to be within a very narrow safety index. And the other one is it has to have a very high protein binding. So as far as drug is concerned, really the 2 drugs that have distribution interaction is Coumadin and maybe phenytoin. As far as herb, I'm not aware of any herbs that will cause distribution interaction with Coumadin or phenytoin. Interaction may occur, but it's going to be through other mechanism. Primarily, it's going to be pharmacodynamic interaction, where some Chinese herbs, in fact, have effect to move the blood. They have anticoagulant or antiplatelet effect. So if anything is going to interact with Coumadin, it will be those herbs with similar pharmacological effect, but not through distribution itself. Okay. Metabolism interaction is going to be more common, and this is where the cytochrome P450 enzyme take place. So in the body, cytochrome P450 is the primary pathway in which the drug and herb are metabolized. And there are some drugs, and there are also some herbs that will affect this metabolic rate. So as some of these drug and herb increase the metabolic rate, you will then have a lower concentration of these other drugs and lower concentration of herbs. And then beyond that, the effect will be decreased, so you're not going to get the desired therapeutic effect. Some of the examples of drugs that increase the metabolic rate include anticonvulsants, phenytoin, carbamazepine, and barbiturates, steroids like dexamethasone, prednisone, antibiotics, and also others, alcohol, nicotine, cigarette smoking, and also St. John's wort. Okay, so what that means is if the patient is on any of these substances, it's possible that they will increase the metabolism of other drugs and herbs, and therefore decrease their concentration and effectiveness. And from an herb perspective, once again, St. John's wort is listed first, and St. John's wort is both a Western herb and also a Chinese herb. As a Chinese herb, the origin is generally used to clear heat. And by heat, it's generally referring to some type of infection or inflammation. And St. John's wort in Europe, its origin is actually also to treat infection as well. It's more recently that most of the use is focused on use of the herb as antidepressants. All right. So what they have found is that St. John's wort has also been shown to induce the cytochrome 450 system to increase the metabolism, reduce the plasma concentration, and the effect of many drugs, including cyclosporin, birth control hormones, theophylline, digoxin, and others, right? So obviously, these drugs are quite significant. If they are going to be prescribed, you want them to do what they are intended to do. So this would be a case where it's important as pharmacists, as TCM practitioner, to ask the patient, what other drugs are you taking? What other supplements are you taking? Because if they are taking St. John's wort from over the counter, and remember, a lot of patients take supplements and they are afraid to tell their physicians because some physicians may be more open, others may or may not be. So it's important to make sure we have a complete record of all the things they are taking, whether it's drugs, supplement, Chinese herbs, and so on. Because in this case, the interaction between St. John's wort and let's say the patient is taking birth control pills, you could make the birth control pills less effective and they could end up getting pregnant instead. So that's obviously a situation we want to avoid. Okay, the opposite to the enzyme induction is the enzyme inhibition. So once again, there are a list of drug and herb that will inhibit the cytochrome P450, therefore decrease the metabolism of drugs, increase the concentration, and therefore increase the effect of these other drugs and herbs. These drugs include antifungal drugs, antibiotic drugs, anti-ulcer drugs, okay, and also grapefruit juice, okay? And from the herb perspective, there are also quite a few Chinese herbs. There's jianghuang, which is curcuma. There's xinyi magnolia flower, and so on, okay? And out of this list, the one you're gonna see the most is probably curcuma, or its main active ingredient, which is curcumin. And curcumin is actually used quite a bit OTC. If you go online, if you go on Amazon or any other websites, you actually see quite a bit of curcumin products over the counter. It comes from curcuma, it comes from turmeric. So basically, curcumin is used as a supplement primarily for its anti-inflammatory and also its antioxidant effect. What also happens is when a supplement is sold over the counter, usually the approach is they take one active compound, they isolate it, they extract it to the maximum concentration, and they put it into a product. My personal philosophy is that once you do that, you are actually moving away from herbal medicine, and this is more similar to a pharmaceutical medicine. Because in herbal medicine, generally speaking, you use either one herb or use one herbal formula. So you really have many ingredients in play, many different compounds. And once you isolate and make it into one compound, it's more similar to the pharmaceutical approach. And there are obviously pros and cons to both. If you identify the right compound and use it at a very large concentration, obviously the effect and potential side effect will be stronger. So you are not necessarily able to extrapolate what you see in one compound back to the herbs or vice versa, okay, because it's really not the same. Anyways, what they have found is that co-administration of curcumin in animal subjects have been shown to inhibit the liver metabolism. And once the liver metabolism slows down, you will then have higher concentration, higher area under the curve for three main drugs. One is rosuvastatin, so that's a statin cholesterol medication, docetaxel, and also tacrolimus. Okay, so once again, this could be a significant interaction because the use of curcumin will then contribute to higher concentration, higher effect of these drugs. And higher effect doesn't necessarily mean a good thing. It could then increase the side effect of these drugs. And that's obviously not what we want. Okay, so once again, it's important to recognize these interactions and take steps toward preventing them or avoiding them altogether. Okay, and like I mentioned, these are studies done in one compound at a high dose in animal studies, not necessarily something you can extrapolate to the humans. So this is something we need to keep an eye on carefully, and then basically continue to see as new information becomes available. Okay, and the last step of the pharmacokinetic is kinetic interaction is elimination. So as the medicine is absorbed, distributed, carry out their therapeutic effect, finally metabolized and eliminated, that sometimes it depends on whether the renal function is proper, whether interaction would occur. And fortunately, our renal function is quite robust. Okay, so in most cases, there is not going to be an issue with drug-herb interaction. With probably the exception if the patient has one kidney, if the patient is renal compromised, if they're on dialysis, then what happens is whatever they take in will likely accumulate and sit in their body for an extended period of time. So usually under those circumstances, the TCM practitioner or CAM practitioner needs to be aware of that and avoid using herbs that may have a more narrow safety index or more likely to cause adverse reactions. All right, so that's the first part about the pharmacokinetic interaction. Pharmacodynamic interaction is going to require a little bit more in-depth understanding on both sides. So Western medicine practitioners need to learn a little bit more about the herb, what they do historically, and also what their pharmacological effects are. And TCM practitioners also need to do the same thing. So as far as TCM practitioner is concerned, it's not enough to learn, whether a drug is a drug for hypertension or diabetes. They need to learn, what category it's in and how it works, right? So what I usually tell them is, well, if the patient is taking an antihypertensive drugs, you need to go one step further and see whether this is a calcium channel blocker, a diuretic, an alpha blocker, beta blocker, ACE inhibitors, and so on, because some may interact with Chinese herb, but not others. Okay, so if the TCM practitioner is going to prescribe a formula that regulates the flow of water, okay, then they have to be careful if the patient is on diuretic, but not so much if they are on alpha blocker or beta blockers. Even though they are under the umbrella of antihypertensive drugs. So like I said, this is where we have to pay attention to synergy, antagonism, and also potentially complementary interactions. Okay, I think one of the more common and also one of the more potentially serious interaction is the one for treating blood clots. So in Western medicine, these drugs are generally considered as thrombolytics, anticoagulant, or antiplatelet type of drugs. Okay, so the mechanism obviously are quite different, but in the end, they help to prevent or treat the blood clots. And in Chinese medicine, these herbs are generally described as herbs that promote blood circulation, that eliminate blood stasis. And most of the interactions that have been documented are ones that focus on two main things. One is either Dansen, which is Radix or Rhizoma salvia, or Dangui, which is Radix angelica sinensis. So Dansen salvia historically has not been used a lot, but these days have been used quite a bit. I think one of the main reasons is we all have a more sedentary lifestyle. Okay, so we are all at higher risk of having some type of cardiovascular disease. So what happened in China now is this herb is used quite a bit, mostly to help to improve blood circulation, to thin out the blood, and also to prevent and treat coronary artery disease. Okay, they use this herb as oral decoction or oral pills, but they also use this quite a bit as IV drips. And in fact, I was quite surprised. The first time I went to China was after I finished my TCM study, and that was in probably 1988 or 89. And I went to China, I went to Beijing, and I studied at Guang'an Hospital. And I remember I was seeing patients in outpatient settings and also in the hospitals. And that was the first time I saw a doctor's note that says Huang Qi astragalus via IV drip. And I just about fell off my chair because I never thought those two words would come together. So anyways, they do that quite a bit now, not just for treating cardiovascular disorder, but also for many other things as well. So like I said, Dansen is a very important herb in Chinese pharmacopoeia, and it's used quite a bit today, but not in the past. But Dangui Angelica sinensis, in contrast, has always been an herb that's used a lot, regardless of how far back you go. And Dangui Angelica sinensis is a herb primarily used to tonify blood or nourish blood. So basically to increase the production of blood. And at the same time, it has a mild effect to also help with circulation of blood as well. Because we want to produce the blood, we also want it to move. That way, it doesn't cause stagnation type of problem. It's like the flow of water in the river. You don't want the river to become stagnant because then it creates problem. You want it to flow properly. So then what happened is in the last no less than 10 or 15 years, most of the interaction focus on if you put these two herbs, Danzan salvia or Dangui angelica sinensis with coumadin, what happens, or warfarin. And what they generally are able to show is that when you combine those two together, you have an increase in Cmax, which is maximum concentration. You have increase in concentration throughout the life of the drugs, and also total area under the curve. So there is definitely some synergy that occur when warfarin is taken with salvia or with angelica sinensis. Okay, I want to go one step further, and this is the example I will use is hirudo or 水蛭. I grew up in Taiwan, and many of my uncles and relatives, they were farmers. So I remember on weekends I would go play in the farm, and every once in a while I would come back with this black thing that are on my feet. And when I was a kid, I didn't know what it was, but I remember my uncle would get a lighter and burn the leech so it would fall off. And later on, I learned that obviously leech suck the blood out of the hose, and that's how they feed, that's how they survive. And in the process, even though we try our best to stop bleeding, whatever we as humans do basically is no match for the leech, because while they are sucking out the blood, they simultaneously produce saliva that is probably the most powerful anticoagulant in the whole world. So as much as we try to have clotting cascade or platelets to stop bleeding, none of it work against the leech saliva. And I remember about 10, 15 years ago, as I went to a pharmacy CEU, I learned there was a new drug called Reflutin. Oops. And guess what? Reflutin. Are you able to see the picture of Reflutin and Hirutin? Oh, I did? Okay. So I learned that there was a new drug at the time called Reflutin, and basically, if you read the history of the drug, it in fact came from natural sources. So it actually came from leech. And there's also another version that's an oral medication called Hirutin, and that's in Japan. Okay, so both Reflutin and Hirutin are anticoagulant drugs that came from an herb called, or animal called 水蛭 or leech. Okay, so if you read further, then basically what it tells you is that be very careful using these drugs along with other anticoagulant, antiplatelet drugs. And then, obviously, if we are integrated medicine practitioner, we need to exercise the same caution because leech in Chinese medicine is generally regarded as the most potent herb that, and the term we use is to break the blood stasis. Okay, so break, you can imagine, is to resolve, to dissolve. And blood stasis in Chinese medicine is most likely thrombus or embolus. Okay, so in Western medicine, you need to be careful if you combine the two. Basically, leech would be the strongest. Dangui angelica sinensis would probably be the mildest. And everything else you saw there is somewhere in between. Okay, so there is some documented risk with coumadin, with warfarin, but with everything else, even though there is not documented cases that I have seen, but pharmacodynamically speaking, there's a chance that based on how the herb work and how the drug work, they can have synergy with each other. Okay, so this is an area where I think practitioners and patients all have to be very careful so you don't have patient end up with profuse bleeding and we don't know why that happened. Okay, this next is an example of possible synergy or antagonism. It depends on how you interpret it. All right, so these are some examples of drugs that are commonly prescribed for asthmatic patients. So you have the bronchodilators, such as beta agonists, albuterol, epinephrine, and so on. And obviously a lot of anti-inflammatory drugs, corticosteroids, mast cell stabilizer, leukotriene inhibitors, and so on. Okay, so these are used for acute, chronic treatment of asthmas. And in Chinese medicine, one of the most important herbs for treating asthma is an herb called ma huang or Herba ephedra. Okay, so this is an herb that is described in Chinese medicine to direct the lung qi downwards. All right, so instead of having wheezing and dyspnea and shortness of breath, this herb will dilate the lung and bring qi or enable the patient to breathe in downwards. Unfortunately, what happened is this herb has been abused quite a bit as a weight loss because of its stimulant effect. So the legal status of this herb depends on who you ask. Some will say it's no longer available. Others still find a way to use it. In any case, many of the main active ingredients of ephedra are the ephedrine alkaloids. So you have ephedrine, pseudoephedrine, norepinephrine, and so on. And obviously, these active ingredients are used in both prescription drug and over-the-counter drugs. Okay, and if you were to look up interaction, it will tell you pseudoephedrine will interact with quite a few other medications, including 181 medications, 1 alcohol, and disease interactions. Okay, so if you are a TCM practitioner, assuming if you still have ma huang available, then when these herbs are prescribed, TCM practitioner needs to be very careful using it, especially for patients with hypertension, patients with metabolic disorder, patients have seizure and epilepsy disorders, patients that may have insomnia, and so on and so forth. Okay, so it's not enough as a TCM practitioner to just know that ma huang directs lung qi downwards. You need to know that it's a very strong stimulant herb for the cardiovascular system, for the central nervous system, for the metabolic system, and so on, in order to recognize and prevent such interactions. Okay, so obviously, if the patient is taking beta blockers or alpha blockers, ma huang should not be prescribed because they are antagonizing each other and they cancel out the effect of each other's. All right, and then this one last example that I will share with you, I will call it as a complementary interaction. Okay, meaning we are able to get the best out of both worlds. You know, the drug is able to do what it's supposed to do, and the herb is able to help in the same process. Okay. This is a Chinese herbal formula called Huang Qin Tang, and that translates to Scutellaria decoction. So Huang Qin, the first ingredient, is also the name of the formula. And this formula has 4 main ingredients. The first one is Huang Qin Scutellaria, and this is an herb in Chinese medicine we describe to clear damp heat. So think of damp as, you know, hot summer days in New York. You feel very heavy and bogged down and not wanting to move. So damp, in a way, in Chinese medicine, describe a more localized problem. Okay, and then heat generally describes the hotness of the disease. So a lot of time, the infectious disease, inflammatory disease, metabolic disease are all characterized as a hot disease. So in this case, Huang Qin is a great herb to treat damp heat, especially in the lung, so for lung infection and inflammation, and also in the digestive tract. Okay, so patients that have traveler's diarrhea, dysentery, and so on, this is a great herbal antibiotic for treating digestive infections and inflammations. And then you have 3 other herbs. One is Bai Sao, Radix peony, commonly known as white peony, Gan Cao, glycyrrhiza or licorice, and Da Cao, jujube or dates. These 3 herbs are what we call as nourishing herb or tonic herbs. So white peony is a herb that nourishes the yin, and then gan cao and da cao, licorice and jujube are the ones that tonify the qi. And I'll come back to this a little bit later as we put all this information together. But overall, it's a great formula for treating damp heat dysentery, so basically infection and inflammation conditions affecting the digestive tract. And what's interesting about this formula is actually quite old. You know, the history goes back about 1,800 years. And honestly, if you are a TCM practitioner, you study about this formula at school, but you don't necessarily use it a lot. But somehow I believe this formula is going to be the most famous Chinese herbal formula in the US, if not the world. And the reason is because how often do you read about Chinese herbal formula in Wall Street Journal? Probably not very often. So I remember when I first saw this, I was quite shocked. Oh my God, why is Wall Street Journal reporting about Chinese herbal medicine? Obviously, you have to take a deeper look. And as it turned out, what happened is This picture is Dr. Chen at Yale, and he was doing a clinical study on this formula, Huang Qin Tang Scutellaria decoction, basically to see how well the herbal formula will work to treat adverse reactions associated with chemotherapy. Because obviously chemotherapy are very powerful, but they also have a lot of adverse reactions. And some of the most common are going to be the gastrointestinal adverse reactions: nausea, vomiting, lack of appetite, inflammation, and so on. Okay, so that was the original aim of this formula and this study. Okay, so they were able to get it off the starting block and begin to do phase 1 and later on phase 2 studies. And I'm going to show you some studies that have been published, but the main idea is, number one, they want to see if the herbal formula is going to be effective to reduce the adverse reaction associated with chemotherapy, mainly GI. But what they also found is that not only does it reduce the side effect of the GI associated with chemotherapy, they have also found that the herb, in fact, will have at least an additive effect, if not a synergistic anti-cancer effect, along with the drugs. Okay, so these are some of the highlights. That the code name or the abbreviated name for this is PHY-906, right? PHY-906 protected against weight loss associated with irinotecan treatment. In the presence of this formula, mice were able to tolerate otherwise lethal doses of the drug, significantly improve anti-tumor effect and the overall survival. Okay, and there's no increased toxicity when the drug and herb were used together. Okay, so they observed something even better in that the herbs help to reduce the side effect, improve the drug effect, and with no increase in toxicity or side effect. And then they were able to proceed to a phase 2 study. And they are, in this case, once again, using the herb to help to alleviate the side effect of drugs for treating hepatocellular carcinoma, and also for drug sorafenib. Okay, so once again, they found this herbal formula to enhance the body's immune response to fight cancer and increase the anti-tumor effect of the drug, to protect and repair the gastrointestinal tract by reducing inflammation and promoting cell tissue regeneration. Okay, so basically they are able to narrow down the pharmacological effect of this formula into two main things. The first is the anti-inflammatory effect. They found the compounds in the herb to inhibit the nuclear factor kappa B, cyclooxygenase, nitric oxide, and so on. And at the same time, the formula helped to restore the intestinal epithelium by promoting the regeneration of the intestinal stem cells. Okay, so if you were to go back to how this formula is constructed, right? So Huang Qin Tang Scutellaria decoction uses the first herb, Scutellaria, to clear DAMP. So once again, this is similar to a Western description of having anti-infective and also anti-inflammatory effect. The next herb is white peony or baisao, and this herb is described as an herb that nourishes yin. And I would say in this case, think of yin and yang this way. Okay, so think of yin as the anatomy, as the form of the body, and think of yang and qi as the function or physiology of the body. So yin and yang basically is not that different from the anatomy and physiology, the form and functions of the body. So when we use herb that tonify blood or nourish yin, basically it was trying to rebuild the organs, the tissues of the body, the actual substance, the actual form. So maybe if the patient has some type of disease, let's say autoimmune disease, in which the immune system actually start to damage, to eat away certain tissues or organs of the body. So that in TCM is interpreted as yin deficiency. So if we are using herb to treat these type of conditions, we would have some herb that tonify yin and nourish blood. But at the same time, the immune system is hyperactive. It's acting, it's destroying many parts of the body. So that function would then be described as yang, too much yang qi, too much heat. Okay, so the last part up here is that you have two other herbs, ganzao and dazao, which is licorice and jujube. So these are literally just food-grade type of herbs. We consume them quite a bit as food. We also use them as Chinese herbs, so they tonify qi. So in this case, what they do is once we use herb to nourish in, to restore the form, we also use herb to help to improve the function of these organs. So ideally, we want our anatomy and physiology to be balanced so they can carry out their normal functions. Okay, so another way to think of this, and I'll use this to sum up the talk, is that I think in Western medicine, we do a great job to treat the disease by using the drugs that have great effect as antagonists, as inhibitors, as suppressors. But in Chinese medicine, we focus on treating the patient that has a disease by using herbs that tonify, that nourish, that strengthen. So we help the body to help itself. Okay, I think both are very important. And as we treat patients, there are times when we need to treat the disease first. There are times when we need to help with the patient so they can help themselves. So in the end, Western medicine and traditional Chinese medicine at one point may be separated by Grand Canyon, okay, but we are here helping to build a bridge so we can communicate with each other better, and in the process, helping the patients better. And if you're interested, this is some of the main places where I get the information from. NIH, US Pharmacopoeia, and also PubMed.
So we have a few minutes. We'll entertain some questions if there are any online or any in the room for Dr. Chen. Emma.
Thanks a lot, Dr. Chen, for your wonderful lecture. I have 3 questions. I hope it's not too much for you.
Okay.
So the first question is how did you carry out experiments or simulations to verify or test these interactions?
Most of the information that I present today start out as theoretical. And if you go back 30 years ago, that's all there was. And today, most of it is going to be through medical literatures. So textbooks, articles that are published, or articles that are in Medline. Okay, so if you do a deep dive, there are actually a lot of information that are available today for you to learn and study from. Okay, so they are basically reported by practitioners, by doctors, and so on, or there are organizations that do these type of studies. And when they do these type of studies, generally speaking, a lot of it is going to be in laboratory animals, but in some cases, you also have some human volunteers that will do these studies.
And my second question is, since there are so many almost endless, countless ingredients of drugs and Chinese medicines, so herbs. So, do you know, is there a way to carry out high throughput, like experiments or researches to test these herb and drug interactions? To make the research more fast and efficient.
The research in this area, I think is going to be quite tough. And it's not so much the medical part. I think it's the incentive part, because this is something that, unfortunately, you're going to have a very difficult time finding funds to do such research, and also finding volunteers who will be willing to participate in this type of research. Because generally speaking, for people to do these studies, they want to have some type of financial incentive, so maybe for approval of the drug and so on. But interaction, there's really no financial incentive. So unless you have government fund or donation, you're not going to have enough money to do research. And at the same time, would you like to volunteer yourself for research on drug and herb if there's a serious consequence? So you're also going to have a very hard time. So like I said, most of the time you have laboratory studies, that's one, or maybe you have case reports. So maybe you have, let's say, one patient that was taken warfarin and is stabilized on warfarin, okay, which is a blood thinner. And then sometime later, this patient started to take some supplements or some herbs or some other thing, and all of a sudden they notice that the coumadin level is off and the patient starts to bleed a lot more, or vice versa. So it could be a case study like that they start to look into, and there's no other factor, no other variable other than this one. So that could potentially be an interaction. So unfortunately, that's how we will mostly learn how interactions occur, what herb, what drug, and so on. And the complexity, I agree, is very challenging. If you have a patient that comes in with 15 drugs and is taking 2 or 3 herbal formula, that adds up to be 25 or 30 herbs. There is no way to say with significant certainty whether interaction will or will not occur. So this is a very early stage of the study of herb-drug interaction.
ICIM is hoping to do some of that research.
Okay, thank you. Thank you. So my third question, sorry, the last one. My third question is, since I think this kind of research is quite important and very helpful for the safety of the patients in clinical practice. So I wonder if there has already been a kind of nationwide or worldwide database of these herb-drug interactions, especially so it can share the knowledge, existing knowledge in concerning the already verified and evidence-based discoveries in these areas, so that the doctors or other researchers can easily transform these, like scientific discoveries into clinical medication practice.
There are some database. Most of the database I'm aware of at this time focus on drugs and supplements, or drugs and vitamins. There are some that also attempt to organize drugs and Chinese herbs. But when I saw the list of websites or database, unfortunately, they are not quite kept up to date, because this is something that requires a lot of work to compile, to keep up to date. So when I looked at it, I think they have great intention, but perhaps not enough funding or not enough people to carry through. Because imagine, if you have curcumin that's listed to interact with certain drugs, which is one compound, and later on you might have quercetin or you may have some glycoside, then what happens is somebody needs to then go in and see, well, what are all the herbs that contain curcumin? What are all the herbs that contain this glycoside or that compound? And pretty soon it becomes a full-time job for at least one department group of people in order to make this a useful database. Okay, so I know there are a lot of people that are interested in doing this, but for me, I haven't come across one that I'm happy with, that I would recommend.
Hi, I'm Anita Marshall. I'm a long-term friend with Dr. Chen. And for comment on your question there, actually, Dr. John Chen's clinical manual, if you look at that, each individual drug explanation, that I tell my students to go there and look for drug and herb interactions. Every single herbal formula is an explanation of what are the ingredients, and there's cautions and side effects. That's where you go look for interactions. Excellent book, Dr. John Chen.
Oh, thank you.
And also his clinical, his books, his 2 textbooks. Excellent place.
Thank you for Thank you for a very excellent and clear presentation. I really appreciate it. Just like to emphasize the potency of Hirudan or leech spit. When patients are clotting off their fingers in the ICU, we actually apply live leeches to their fingers because of the anticoagulant effect of the leech spit, the Hirudan, and that helps dissolve the clots and save the digits. So just to emphasize that.
Yeah, very nice. Okay, well, thank you very much.
Hello, Dr. Chen.
Oh,
We have one question online.
Okay.
Kimberly is asking, she says, great talk, Dr. Chen. Where can we get more information about drug-herb interactions since there are so many potential reactions?
Well, like I said, these are three sources that I use quite a bit. PubMed is probably the most useful. And once you go to PubMed and you type in the heading of herb-drug interaction, you will then have probably no less than 50 or 100 articles. So I would say information right now at this point in time is sort of scattered everywhere. Some of the article will focus on drug interaction with one substance. Some will focus on with one herbal formula. And there will be some that try to summarize everything. But I think at this time, there is not a single database, that enables you to put in all the drug in patient's profile and put in all the supplements and herbs in patient's profile, and then voila, magically tell you, whether there are interactions or not and how severe they are. But I think we will get to that point. We will definitely get to that point because I've been doing this for about 30 years, and when I first started, there was basically no article. There's no research on Chinese herb and their pharmacology and research and so on. And I think in the last five or 10 years, there's a significant change. You type in a Chinese herb. If you type in, for example, Huangqin Tang Scutularia decoction, you will see many links, to learn additional information. So at some point in time, this database, I'm sure, will be compiled and maintained up to date. And then instead of giving you 500 interactions, we'll give you some that are actually clinically relevant, so you don't end up with paralysis by analysis, but end up with something that's actually useful. So I see that happening, I would say optimistically within the next 5 or 10 years max.